Hospital, and she's going to be talking about something really unusual. Can everyone see it? I think you got to, this is pretty cool. This is something even new for me that I haven't seen before. So can everyone see okay? Can everyone see? Come on a little closer if you want to. I want to make sure that everyone gets a look at this because Katie's going to explain exactly what's going on. Go ahead, Katie.
Thank you. Hi, everyone. So my name's Katie Woodley. I'm a small animal veterinarian at Westside Animal Hospital. One of the neat things that I've been doing for the past few months is acupuncture on our clients' animals. So everyone always wonders, hey, how's my animal going to respond to having needles put into it? The amazing thing is they don't even notice. So this is my dog, Finn. He's a German Shepherd. He's 7 years old. He's doing pretty good for his age. He does get a bit stiff. So the way I distract the animals during my acupuncture consults is I feed them frozen baby food. As you can tell, he doesn't really care about anything that's going on right now. So with acupuncture, it's been amazing service, and it's offered a lot of clients an additional pain relief modality. So a lot of people, they put their animals on pets, they worried about side effects from those medications. Acupuncture is safe, it works, and it relaxes the animals. I have my clients coming in and telling me their pets love it. They are excited in the parking lot. They're barking in the car because every day they come in and see me, they get a treat, and then they feel better leaving the clinic. There are so many other uses for acupuncture, so if this is something that interests you or you're excited to see how it works closer up, stop by our tent over there, the Westside Animal Hospital tent. More than happy to talk about it. So what I'm going to do is I'm going to put a couple needles in Finn. You can see what I do. Each point has a different reason why I use it. There's relaxing points. There's points I use for trigger points that are in tight muscles, but you'll see that he responds really, really well to it and doesn't even notice what I'm doing.
Okay, and what we're going to do is we're going to do this live because remember, I was on TV for many years, so I'm used to being able to go live, and obviously so is Katie and so is Finn, and Katie's going to explain exactly what's going on, so I'm going to go ahead and put this microphone close to her. I had a German Shepherd too. Her name was Max.
All right, so this first point I'm using is a general relaxation point. So you can see the needles in, he didn't even notice. So what I'm going to do is just keep going. There's a couple points I usually start with. I'm just using my landmarks on the dog to find those points. Didn't even care. So now what I'm going to do, Finn tends to get really tight along his back. Just being a German Shepherd, they overcompensate for hip issues, that kind of thing. So I'm just going to put a couple needles along his spine. You may see some tension, but that's because he has trigger points, and I'm helping to relax those and relieve some of that pain that's there.
Typically, how long does a session like this take? I mean, is it dependent upon the individual procedure you're doing and why?
It does. Usually for my follow-up sessions, they're about 30 minutes long. So to place the needles takes about 5-10 minutes, depending on the animal. And then I sit there with them for about 15 minutes and let those needles really do their job and work. And then afterwards, what I always do is I massage them down, and it helps relax them. And one of the cool things that happens with these needles is they're actually releasing endorphins. And so what that means, so a lot of runners will understand this. If you go for a run, you feel great afterwards. Those are the endorphins that are being released. And so that's exactly what these needles are doing too. They're working with the body also to produce their own pain medications. So there's a lot of really neat things going on with these needles.
How young is your youngest patient, and how old can be your oldest patient?
You know, I have a variety of animals. I can do this up until the day that the animal passes on or we end up putting them down. And it's great because it keeps them feeling good and relaxed until the very end. So I do have animals that are like 16 years old and they're still going strong. They're off of all their pain medications from acupuncture alone. I can do it on young animals too. I can do it on animals that receive dental cleanings to help with pain from extractions. And it also helps with general anesthesia, reducing the requirements for general anesthesia, keeping them safer during and after their procedure.
I got to ask about cost. That's going to be the next question that on everyone's mind. Cost, and with doggy insurance, does it cover it with that too?
You know, there's different types of doggy insurance out there. I'm always a huge fan of it because it takes away the stress of worrying about costs for taking care of your pet. So one of the things to do is ask about the insurance. If you have insurance, what it covers, because each plan is different, just like our human insurance. So for the cost for doing this, so for the first consult, what I do is I go through and I do a full physical exam, I do a full orthopedic exam and a neurological exam to locate exactly where they're sore. And so there's a lot of time taken into that. I'm with you during that whole session. The first session lasts about an hour, and then that one costs $120. After that, the follow-ups are half an hour. They're $60, and what we're doing is we're going through making sure that all the restrictions and the myofascia, the pain's being relieved, and then based on how the dog's doing, they don't have to come back every week. It can be dictated by how they're doing with their acupuncture sessions. So I have animals now that are coming back for follow-ups every 2 months now, and that's keeping them pain-free. I've had a few animals where the owners were going to put them down because there was nothing else they could do. Pain meds weren't working. There were no other options for them, and we started acupuncture, and it actually fixed their pet, and now they're acting like a puppy again. So it's something that's just really neat. It's a newer option for all our pets out there, and it's becoming more popular. Works the same way it does in people. So if you've had it done yourself, just imagine how great you feel afterwards, and that's how your pet feels.
Now, does anyone out there have a question? Come on up and I can go ahead and just mic you up. And if you have a question, I'm more than happy to have you ask Katie that. And also, Katie, while we're waiting, if someone wants to do that, okay, this is a two-pronged process. Yes, you have your dog. Yes, you have you. But you also have somebody helping you. You might want to introduce him.
So this is my husband, Ryan. So obviously Finn's really relaxed with him, but also Finn's very food motivated. So it makes it a little bit easier. But honestly, I do acupuncture on cats, and they just lay there on their favorite pillow in my massage therapy room, and they let me put needles in them, and they do amazing with it. A lot of pets go to sleep during it also, which is really neat. You'll see our little Harley roaming around in his wheelchair. You'll probably see him around our tent, but KJ has him. Here he comes. He's coming out, and we're doing acupuncture on him, and he's starting to regain function of his back legs, and he can start wagging his tail, and he was completely paralyzed from the back down, and so he's our little miracle dog that we've been working on.
And how do you know, I mean, so many people say they're acupuncture and acupressure experts. How do you know what's what and that person is who they say they are? I mean, is there some things that they have, you should, as a doggy owner, ask the veterinarian prior to doing anything?
Definitely. So my certification is in medical acupuncture. So I was certified up at Colorado State University, and my course was all evidence-based medicine. So you want to make sure that you're seeing someone that is a veterinarian who knows how to work with animals and is also certified in what they're doing, because a lot of this is based on anatomy, and it's based on where the nerves and the blood vessels run. You want to make sure people know exactly what they're doing.
All right, does anyone have any questions? If you do, if you're a little shy, that's okay. I'm happy just to, just go up there to you, or if you don't have any questions, that's okay too. Now, this process itself is going to, this process itself, normally, since we're talking, is going to take X amount of time, but normally how long would the process take, and then you put in the needles, take out the needles?
So it takes about 30 minutes from start to finish. Putting in the needles takes about 5 minutes, and they stay in for about 20, and then we remove them after they've stayed in about 20 minutes or so, and then they get a good rub down afterwards. So the whole process is about 30 minutes for the follow-ups. Like I said earlier, the first time is longer because we're doing a more thorough exam, and it's taking longer to find those areas where they're having issues with.
And with your dog, the results after the session?
Amazing. It keeps him going. He's older. They have problems as they get older, especially shepherds, and he acts like a puppy. People say he looks like a puppy all the time.
All right, well, thank you so much, and it was a pleasure meeting you and learning more about acupuncture, acupressure, and meeting your husband and your puppy. I'll always say a puppy. It won't be a dog. It's a puppy in my mind. Even though my dogs are 4 and 3, they're still puppies.
Thank you.
All right, thank you very much. He's the strong but silent type.
Thanks very much.
And I'd ask the dog how he's feeling, but I think he's feeling okay because he's eating a lot of good dog food. Thank you so much. All right, once again, you are watching Acupuncture and Acupressure on Periscope live on CS Gazette. I'm going to go ahead and sign off and continue on with Pooches in Pink, the Pictacular. All right, that's pretty cool. How about a round of applause for Dr. That was great, Katie Woodley. Awesome. Once again, if you have any questions for her, she's at Westside Animal Hospital. She'll be here for a few more minutes. She'll be walking around, and you'll be able to see the benefits that acupuncture has made for her dog as well. So that'd be great. Thank you so much. At this moment, let's go ahead and talk a little bit about